At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to this episode of GLI Live on influential women in healthcare. I also realized that it is National Physicians Day, so I'm excited to be able to celebrate one of my favorite physicians. And as someone pointed out to me, I have more than a few. So that is really saying something. And that is truth. I am so excited that there were 5 Wednesdays in this month so that I could share this incredible, rich array of wonderful women that I am honored to know and to have as mentors throughout my career with you. So today we have Dr. Helen Burston, who is the head of the Council of Medical Specialty Societies, and she will explain what that is. I'm very proud to be the public member on the council, we could spend all day just dissecting and reading the letters that follow Dr. Burston's name. She has more that follow in the bio, and we will include a link to her LinkedIn profile so you can understand all the richness of her experience. And we'll only be able to tap in just the tip of the iceberg today. But why don't I introduce you and allow you to say hello, and we can get started. Hello,
Wonderful.
Helen.
Hi, everybody. Delighted to join you, and especially always happy to do anything Donna asks. She's really one of my favorite patients and leaders, and I still have to say I deeply remember the first time I heard your story at an NQF meeting. Oh boy, that must be 5 to 10 years ago. And being just riveted and so amazed at how you had transformed your experience into making a difference. So thank you on this National Physicians Day, because we can't do it without people like you pushing us to do the right thing.
I think the partnership between patients and physicians is so important for the well-being of both. I care deeply about not only the physicians who care for me, but all the physicians around the country and all around the world who have made this decision to make this not just their career, but answer this calling of the profession that I have such a deep respect for. So, Helen, why don't you tell us about the work that the council does?
Oh, I'd be delighted. So as you know, we are a coalition of an organization of organizations, really. So we have 48 specialty societies across all of medicine, from primary care to surgery and everything in between, coming together to really focus on how we can collaborate, have a collective voice to really drive improvements in care, improvements in equity, and then also really importantly, improvements in education, particularly for physicians, but I hope broadly as well. And I think it's that ability to come together and that willingness to collaborate that I think gives us a real ability to increasingly make a difference in what can be a crowded sort of organizational space in medicine.
Absolutely. For every patient who ever wonders, do these doctors ever talk to each other? They do.
They do, and they don't do it enough clinically. And I hope that's part of what we actually drive, because from the patient perspective, you need to assume that there is a link, a true collaborative thread that goes across everything we do. And I hope that that's part of what CMSS can promote.
Well, you've certainly created a space where the medical societies, which really help educate, train, and support their physician members, to come together and to share best practices and to raise each other up, and that's so exciting. Not only in the sense of the medicine and the clinical side, but in the professionalism of what it takes to run a medical society. And I think increasingly patients are getting insights into that as patient advocacy organizations work more closely or in different ways with their medical society partnerships. But how do both those sides work at CMSS?
No, that's a great question. You already prompted like 17 other things I could say. Um, but I think, one really important piece that you raised was the critical role of the patient voice into the specialty societies. As many folks listening know, it's the
Mhm.
specialty societies who set the clinical guidelines, set the
Mhm.
clinical standards, offer those best practices, in fact,
Right.
publish the journals where most of the important research in a given field is
Mhm.
published. And so the ability for patients to have a voice, a way to influence, a way to share their perspective is what's,
Mhm.
I think, something we, increasingly see. I mean, it's phenomenal having you as the public member of our
Mhm.
board. I hope all of our societies increasingly recognize and embrace patients as part of their governance. And as you know, we also have been really lucky to have a couple of awards from PCORI, the
Mhm.
Patient-Centered Outcomes Research Institute, which you've been helping us out with. Thank you as
Yes.
well. We really are now exploring, patients are increasingly leading research, and we've seen
Right.
that through, the efforts you have done,
Mhm.
the partnership we've got now with the patient-led research collaborative on long COVID. They
Right.
are leading a different model that is
Mhm.
not just, "Hey, would you like to be a patient at our table?" But, "How
Mhm.
do we set this table together? And what
Right.
does meaningful collaboration mean? How do you think about what the outcomes that patients think are
Mhm.
important? Drives our quality metrics, drives the outcomes we think are most important." I think we're at a transformational point, and I'm so excited to see groups like GLI and the
Mhm.
PLRC driving that change, because it's not just the sort of deferential, "I'm here to see how I might be able to talk to you about our issues." No, 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 you need a seat at that table,
Mhm.
have a level of influence that I think changes everything about what we do. My old boss, John Eisenberg, may he rest in peace, was an amazing leader
Mhm.
in patient safety. And he used to always say that patient safety is a team sport and the
Mhm.
patient's on the team. And I think you can make that same case for diagnosis, that same case for a whole series of issues where patients have just not had a strong enough voice.
I really thank you for that. It's so healing. It's a balm to my soul, for the years that I've been, working to shift that perception that it's not something that physicians and the health system should think is threatening, but something that really can help healthcare and medicine thrive. So thank you for that. Um, I you have been involved. Your mention of John Eisenberg. Now there's the Eisenberg Award of quality, so it really is setting the standard. But you have been involved in so many key moments across your career and the things that what I call allow us to have hope in health for healthcare. And so, can you share with us your path to this role?
Yeah, it's a pretty complicated path. And it's funny when I talk to residents or people interested in medicine,
Hmm.
even pre-meds, I often
Hmm.
just say that, life is what happens when you're busy making other plans. It's one of my favorite quotes from a
Hmm.
John Lennon song. And I think I was very open to what those new possibilities could be.
Hmm.
So I did my residency training at the old Boston City Hospital at Boston
Hmm.
University Medical Center, really intentionally because I wanted to do public health. I wanted to do
Hmm.
community-based care. And as a child of immigrants, equity has always been really important to me from
Hmm.
day one. And training in a place like that was just so key to my being. I then was really lucky to be able to do a fellowship in health services research and quality at the
Hmm.
Brigham Women's Hospital and Harvard School of Public Health. And, back to that question around diagnosis and safety, I was able to work on the Harvard Medical Practice Study, one of the sentinel
Hmm.
studies of patient safety. And I was given the whole portfolio around equity. For
Wow.
example, we showed uninsured were 2.5-fold more likely to have
Hmm.
negligent medical errors, adverse events than others. And so being able to build on all of that work
Hmm.
around safety and quality and equity, I
Hmm.
was asked to take on the role of leading quality measurement at the hospital, which was amazing and a great experience, and learned more, I think, in that role than anything else. And then was recruited by John Eisenberg to lead one of the research centers at ARC. And I remember he called me and I'm like, I just got promoted to Harvard Medical School. I just bought a house on Cape Cod, and like, why would I move? And the next thing
Mhm.
I knew, 4 months later, I was moving to Washington, D.C. But I knew it was the right next step in
Mhm.
my path, and was really lucky to then be in this extraordinary place with people like Lisa Simpson, Carolyn Clancy, and John
Mhm.
Eisenberg, who I then had the ability to learn so much from. And then was kind of getting itchy, a little bit bored, trying to figure
Mhm.
out what I wanted to do next, and was recruited for a job and wound up talking to Janet Corrigan, who had just taken a
Mhm.
position at NQF as the
Mhm.
CEO, about this other position. And then she said, "Wait, if you're actually available, do you want to be my senior vice president?" And like, it became this whole, okay, well, let's take a look at that. And so just open to that possibility. Wound up being there actually for 10 years
Wow.
as chief science officer, and then was recruited to take on this new role
Mhm.
at CMSS, and very much saw it as an opportunity for building. And I think just
Mhm.
as a sense for me is, over the years, I've recognized how important it is for me to have a position that is creative and building, and
Mhm.
just running something that's kind of there doesn't do much for me. So this has been a great
Mhm.
opportunity, as you've seen, to really build, see the potential for what we have, and really kind of take advantage of it. Um, but yeah, overall, just so excited to have seen where it's led me. And really importantly, I
Mhm.
have never stopped seeing patients. I
Oh.
still volunteer and teach residents a half day a week at GW, and I teach
Mhm.
journal club with the residents. And I do it, I think, more for me than
Mhm.
necessarily for anyone else. It grounds me to
Mhm.
see what it's like for patients to not be able to get the treatments they need, or to watch a
Right.
doc spend an hour on the phone getting prior authorization for a
Mhm.
medicine a patient has been on for 3 years.
Right.
So just that perspective has been really important for me, and I've just loved the ability to still get to walk into a patient room with my resident and just have a conversation. It's why I went to medical school in the first place, and I'm really lucky that GWU lets me kind of have that opportunity once a week.
I think we're lucky too, and now I'm speaking as a role as one of the board members. Um, I think that's one of the keys to why you keep creating and presenting such relevant, resonant programming for the organization, and lead with such a great sense of a true north, because you are still in touch and immersed in the issues, in the reality of people's lives and of care today. It's easy to think about
Yeah,
it as it's written about in textbooks or even newspapers, but that's often not the reality of how healthcare
yeah,
actually gets done. I like to think that my, frequent forays, into patientdom, whether it's in the, infusion lab, or or in a retail store picking up a prescription, or something else, or being a patient in the ER in the hospital, and on whose board I sit, really helps me.
absolutely.
It keeps me grounded in ways in the leadership of GLI that I think it
Yeah.
wouldn't be possible. It wouldn't even occur to people unless you've actually, you have to see it to believe it.
Without a doubt, without a doubt. And I also think it's the richness of what we do and why we do it. It's all about the ability to talk to a patient one-on-one and really hear what their concerns are. I mean, talking to patients through, COVID about vaccination has
Mhm.
been more eye-opening to me than almost anything I've done in terms of shared decision making, and really understanding what's hesitancy and what's really
Right.
about having a discussion and an open discussion to answer questions in a way that's respectful.
Right. And
So
I interview all the doctors that I come into to contact with. How is this working for you? What do
yeah,
you think about this? The health system, certainly
right.
whether I'm out at a, community, oncology practice or GI practice,
Yeah,
or in a primary care, my poor primary care doctor, I'm always like, what would make you, test for something, like how many, conditions, or what in the family history would be
right.
sufficient threshold for you then to want to seek to diagnose. So I'm always sort of,
Yeah,
peppering him with questions that have nothing to do with my care. But
it is.
but I think it ultimately, he understands how they convey. So I think your sense of openness is one thing that I want, people to take away from this. Certainly, you had a high degree of preparedness for a lot of these opportunities, and you kept your connections so people knew that you were even available for these opportunities, or that you were front of mind for
Right.
them, and then you were open enough to hear them out. I sort of laugh when I hear young people with their plans. I was like, I did not think I'd be doing this,
No, no.
or
Mm-mm.
any most of the things that I do. Um, and so, but it's a privilege to do them. And so, one of the things that I noted is that the current president, or current leadership
Yes.
of CMSS and the immediate past, are women. And so how has female leadership in medicine and and medical societies,
Yeah.
has it changed things, and if so, how?
It's a great question, Donna. I just did a talk last year at the
Mm-hmm.
Women in Medicine Summit about
Mm-hmm.
what do we know about women leading in a crisis.
Mm-hmm.
The data is really striking. If you
Mm-hmm.
actually look, women actually scored better. This is a great article in Harvard
Mm-hmm.
Business Review in 2020. Women actually scored better than men pre-pandemic, and that
Mm-hmm.
difference grew during
Mm-hmm.
the pandemic. And I think what's really interesting is, again, not to generalize, but this is what the
Mm-hmm.
research would suggest, is that women tend to be more collaborative,
Mm-hmm.
tend to value teamwork,
Mm-hmm.
um, tend to have empathy and humility
Mm-hmm.
in a way that I think allows you to address a situation in a crisis in ways that I think are value added. And we saw that at the national level with some
Right.
leaders, for example, from New Zealand and other countries are led by
Mm-hmm.
women. Just, your willingness to listen to your kitchen cabinet, your
Mm-hmm.
willingness to be open, again, that
Right.
word, hearing views that are different
Mm-hmm.
from your own, I think are some of the hallmarks of what women make women really great leaders.
Mm-hmm.
And it's interesting. One of the other articles I saw as part of this looking over, because I pulled my slides from that earlier, there was a great quote from paper in Jessica Stillman had written in Inc. in 2021. And she
Mm-hmm.
said, while charm and confidence may help leaders achieve top positions,
Mm-hmm.
qualities like empathy and humility are
Mm-hmm.
critical to leadership. And when you look at the qualities of women
Mm-hmm.
leaders, empathy and humility are near the top. So,
Right.
in short, I think it's changing medicine because I think it's allowing more of that empathy, humility, collaborative spirit to move
Mm-hmm.
forward. So I'm actually excited. I think it's been great to see. I think, medicine is now more than of the medical students, it's about 50% female, a
Right.
little bit more. But what we still have is just this is about leadership. And I think
Mm-hmm.
still a significant deficit of women rising to the ranks, getting to the CEO positions of health
Mm-hmm.
systems, societies, et cetera. Um, and I really want to mention in particular, it's if we think we don't even know the data, but we know it's
Mm-hmm.
far worse if you're a woman of color.
Mm-hmm.
So I think really recognizing the intersectional issues are key here. But I think we can change medicine. Heck, I think we can change society broadly. But we have to be able to break through those glass ceilings, and women need to have a chance, and not just get offered jobs. Women. There's also this concept of the glass cliff I had talked about. Of
Mm-hmm.
women tend to get offered positions that are kind of, boy, they're really dangerously, risky for you for your profession. That's kind of a
Mm-hmm.
cleanup. And so
Right.
I think we have to keep our eyes open. But
Mm-hmm.
I'm excited to see how women can and will change medicine going forward, and particularly if we can get more women into those leadership roles.
Absolutely. Um, my husband might refer in a candid conversation to Donna's "I am not the maid" conversation. I remember his head whipped. He's like, "Oh my gosh, who is she talking to on the phone?" But it was a situation that you know it was something was going to have to be cleaned up, and I was um, happy and qualified to be put forward to, you know,
Right.
make it all work out. Because I fix things, I get things done. That's part of the
I
brand.
actually know exactly what you're talking about.
Exactly. But but I expected to be compensated
Right.
for it, and the assumption had been just that. I'm like, well, you'll just sort of do it. I'm like,
Mm.
no.
No, no, no. Yeah.
If somebody else had to do it, they'd be
Yeah.
compensated for it, and so I
Absolutely.
expect to be compensated for it, and I have no problem walking away. And so it is um, the confidence of of knowing your value
Yep.
and owning that, that is one of the reasons it's exciting to be over 50. Because it's just
I
like
like it.
it took me several years to work up to that, but
Yes,
I'm
I agree.
excited
I
to
agree.
help young women come to that faster,
Yeah,
to that
yeah.
fast.
The other interesting thing is we often talk about, and we're
Hmm.
delighted that you're one of the newer members of Women of
Hmm.
Impact, this group of women in healthcare leaders.
Hmm.
One of the things that's really striking, as wonderful as it is to have our peers who help us at that
Hmm.
level, I also learn just as much from the young people I
Hmm.
supposedly mentor, who I think sometimes push us in ways that
Hmm.
um, I don't think I would have done without a push from some of my younger colleagues who don't have some of the baggage we've brought along over the years of what I can and should do.
Right.
And sometimes it's okay to just say, no, we're going to do something really different here.
Hmm. I agree. The average age of a GLI employee is dropping rapidly, and and I think that's fun and exciting, and
Yeah,
it makes me better, and it makes sure that we are resonating,
yeah,
across the age groups and generations, and reaching people, um, where where they are and how they want to receive
yeah.
information, how they do receive information. And so it's been real exciting to to trade tips on different technologies
Yeah.
with them, and have them train me, and me also to give them some tips on some of the older platforms. But it really is so important to have that mutually beneficial mentorship that goes in all these directions. I also think that the um, the value of that I get a chance to hang out with doctors, that I get to hang out with payers, and folks in with other stakeholder groups, expose me to ideas and make me think from different perspectives,
Yeah.
that I feel helps um, helps my patient advocacy, and helps the solutions that we develop
No
um,
question.
stick. They're more, the more we can understand um, the incentives and the concerns of physicians, of our medical society partners, of other groups, the more that we can address them, and the solutions aren't just sort of things that patients want, but they're things that would benefit patients but work within the system, or change it in ways that it really can and will be changed. And so I benefit richly from the generational,
Yeah.
from the different, even the different. I think people think that, physicians think like, well, understanding that, well, um, uh, gastroenterologists may think this way, but nephrologists may think a little
Right.
differently. Primary care is viewing it this way,
Right.
and those nuances, to be able to have solutions that stick,
Yeah. I agree.
is exciting to
I agree.
have.
Yeah. I also think, just as somebody who led, a
Mhm.
consensus development process, the
Yes.
ability to think across stakeholders and
Hmm.
reach consensus is a secret power that I think we haven't really taken advantage of. I some
Hmm.
have sometimes joked that I like conflict. I don't like conflict. I just like resolving conflict. And
Right.
I think that's part of what excites me about CMSS. I think
Hmm.
the ability to put people together
Right.
across different domains and specialties and disciplines,
Hmm.
and including patients at that table, you can reach consensus on issues in ways that if we just talked about each other in the
Right.
abstract, like so and so thinks this way,
Right.
so and so, we can make so much more progress. We're just stronger together.
Hmm.
And I think we sometimes lose sight of that when we get into these sort of internecine squabbles about things that just aren't very valuable. At the end of the day, we need to do what's right for patients. So that's all. That's why we're here.
Hmm.
And so I think that's so much of what I think we can build as part of CMSS and other groups.
I totally agree. If you don't, expose or have an ability to confront the conflict, you can't resolve
Absolutely.
it.
Yep.
I read a really great book, and I'm gonna reach over and look at the title. I never thought of it that way.
Huh.
By Monica Guzman, who runs Braver Angels and specifically has conversations from bringing people from urban environments to rural environments, from bringing Republicans to Democrats and Democratic groups, to Republicans, to have structured conversations
Yeah.
in how to really know each other,
We
come
need
to a
that
point
more
of
than ever.
understanding, and then maybe maybe we're not as divided um, as we think we are, or as divided on as many things as
Right.
we think we are. One of my favorite takeaways from the book is that um, in many cases, it's not that we don't share the same values, but that we don't have them in the same priority order.
Mm, right.
So, rather than thinking physicians don't care about whatever, well, they might value that, but they just value it in a different order than
Absolutely.
than than patients do, and so it might help us sort of soften
No,
the.
it's a great point, and as you know, we're doing this work with CDC on vaccination, an important issue for
Yes.
many of the folks listening. And the goal of this is to really say, back to the team sport analogy, vaccination's got to be a team sport as well.
Yes.
And I know absolute says your primary care doc is the only one who can do it. It is
Right.
sort of core to what we do as
Hmm.
primary care docs, but I think that what we're trying to do is exactly that. We're on your priority list
Right.
as a hepatologist is asking about vaccines. It
Right.
may not be top of the list like it is for primary care, but
Hmm.
what does it take to raise it up on your priority list such that you ask about it, you assess, you recommend, you refer somebody, rather than just assuming that's primary care stuff. But you're right, moving the
Right.
priority order around can have powerful
Hmm.
impacts just by listening and understanding where somebody sees it in terms of where they fit and where they don't. And I think that's also a huge issue for equity. And that's one of the
Hmm.
questions we wanted to talk about as well. How do we get equity to rise up to the same
Hmm.
level that we've been talking about improving care for all these years? I often, in the work I did, leading the first National Healthcare Disparities
Hmm.
Report and a lot of our equity efforts subsequently, it is always the afterthought, and it can't be that way. So I think
Right.
that same issue is how do we raise it up so that it is not that it's higher on everybody's priority list and it
Right.
stays there. And I think that's one of the
Hmm.
concerns right now. It's great to see all the energy focused on equity and
Right.
D&I, but what does it take to build that into the fabric of what we do every day, as
Right.
opposed to something we come back to? So we've now got these joint projects we're doing across our societies to both influence how do we get more underrepresented in medicine
Right.
into the pathway towards medical school, help them go over some of those
Hmm.
significant boulders. But then once you're in there, how do we make sure you succeed? How do
Right.
we what can we do to ensure
Hmm.
that everyone has not just an equal playing field, but that who has the advantages they need to be able to overcome some of the barriers that have been put into place. And so we think really all of our societies have a significant responsibility there to ensure that women and minorities and others rise up through the ranks and help lead those organizations, and get the opportunities through mentorship and sponsorship to have them succeed in academia and
Hmm.
practice whatever it is they choose. But this is a moment we shouldn't squander, and I hope
I absolutely, we need to
we
make
keep it
sure,
there. Yes,
yeah, it's not just a moment. What I was going to say, and I apologize for interrupting.
please.
One of the, insights that I heard that gives me hope was from a fellow advocacy leader recounting members of her medical advisory board on social media, recounting instances of racism that they had experienced in medical school.
Yeah.
And, this advocacy association leader, it never occurred to her that, these esteemed, key opinion leaders, the, medicals, they're, chiefs of this and chiefs of
Absolutely.
this and that, so accomplished that, that they had experienced these, just could be or meant to be crushing moments
Right.
along the course of their careers. And in a previous setup, I had my Harvard diploma above my head, hoping that people would be less likely to tell me stupid things. I'm about to move it back, but I
Did it
said
work?
I said to my, it's a little bit. I think some people, but I in the early days after George Floyd, when talking to my team, I pointed out this diploma does not protect me.
No.
I'm
That white
just
coat
like,
doesn't protect people in the
yeah,
exact same way. Right.
exactly.
And we've got to
And
recognize that
so,
and fix that.
right. And so as we think about, what equity looks like and what it takes to make healthcare, high quality healthcare accessible to all, and
Right.
to equate equity with high quality, it's really going to take a deeper level of empathy and humility, as you pointed out, than we've
Commitment.
really been able to exercise before,
Yeah, and deep commitment
and
that
deep
this
commitment.
isn't just the issue we're dealing with now, but if this doesn't stay on the top of that priority list, we're not going to make significant progress. It has to be sustained. And that, I think, is again where, as we think about what we can do, the power of bringing 48 societies together to work on something is always going to be stronger than one society saying, hey, I wonder what we could do to really improve and increase the number of underrepresented, entering into medicine. We can be so much more powerful together. And I think especially if we hear people's stories, if we listen to the voice of the patient, just so many opportunities for us to make a real difference.
I agree. Thank you.
Sure.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.